Treating overactive bladder symptoms can be a step-by-step process to finding the right treatment for you. This is often presented as a care pathway, which guides you through the progression of treatment options to help you find relief. First, your physician may have you try pelvic floor exercises to help you strengthen your bladder or bowel muscles. And you may try behavioral modifications by managing your fluids and diet to reduce bladder or bowel irritants. Typical behavioral modifications include drinking less coffee, trying to train your bladder to go longer between restroom breaks, and avoiding spicy foods, which may contribute to your symptoms. When behavioral modification and pelvic floor exercises do not provide relief, the next step in the care pathway is to try medications. OAB medications try to relax the bladder muscles to reduce overactivity and increase the amount of urine the bladder can hold. Although these medications may provide some relief, they can also have side effects, so it's important to talk to your doctor about your overall health when trying medications. If you're still looking for relief after trying medications, there are clinically proven advanced therapies that can provide relief. Advanced therapies may include periodic Botox injections into the bladder, frequent in-office ankle stimulation sessions, or a long-lasting implanted therapy called sacral neuromodulation, or SNM therapy for short. Your physician will provide you information and help you decide which of these therapies you want to try. Bladder injections of the neurotoxin Botox can calm your bladder muscles. This therapy typically lasts about 6 months, so you'll continue to come in for injections to continue getting symptom relief. Periodic in-office ankle stimulation, also called PTNS, delivers pulses to the tibial nerve in your ankle. The pulses to the tibial nerve travel up your body and can affect the communication between the brain, bladder, and bowel. PTNS requires weekly treatments in your doctor's office for the first 12 weeks, and then requires monthly office visits for maintenance treatments to continue getting symptom relief. SNM therapy uses a small implant to deliver gentle stimulation to the sacral nerve, located in your pelvic area, to affect the communication between your brain, bladder, and bowel. Many patients have seen a significant reduction in their symptoms with Axonics therapy. In a recent study, 89% of patients with Axonics therapy found a greater than 50% reduction in their symptoms, and 80% of those patients had a greater than 75% reduction in symptoms. Your results and experiences may vary, as they are unique to each patient. Axonics SNM therapy offers long-term relief without frequent or periodic retreatment. It's expected to last over a decade, and depending on your specific therapy settings, it can last around 20 years. The care pathway is an important tool to help you along your journey to finding relief. It's important to know there are additional treatment options if your current treatment is not providing relief. If you've tried medications and think you're ready for an advanced treatment that offers long-lasting relief, you may be a good candidate for SNM therapy. Talk to your bladder or bowel specialist to learn more.